Greetings! Welcome to the AIDS Call-In Live. I am your hostess, Sista Yaa, and I am here representing the Brothers Health Collective. You are looking at the AIDS Call-In Live, and it's the CAN TV. But if you don't have cable or some of those channels that come on cable, you can watch this on the World Wide Web. That's right. Go to www.cantv, all one word, .org/hotline, and you can be watching me live. I am Sista Yaa, here as in working with Brothers Health Collective, where they offered free HIV testing as well as hepatitis testing and peer navigation. This is the AIDS Call-In Live, and the Brothers Health Collective wants you to know that you do not have to go through this process alone, that if you need help, if you need someone to help test you and get you connected to a provider, they are able to do that for you. Eric Kabler is the CEO. They're located at 2517 South Archer. As you can see, the phone number there is 312-808-1044. But because this is the AIDS Call-In Live, if you are watching this show, I encourage you, if you have any questions about HIV or STIs or any comorbidities that I can probably work with you. I am an epidemiologist, and I am with my own organization, and that we are TACS, the Association of Clinical Trial Services. I bring the science to the people. Well, at least I do my best with what I know. And if I don't know, I'll find somebody that does. So that is TACS, the Association of Clinical Trial Services, from which I am a community epidemiologist, and we try to do our best to talk about topics that are very important to our community as it relates to infectious disease, more specifically as it relates to HIV, STIs, and other types of comorbidities. So if you have any questions about that, please give me a call. I want you to know that something I do is I work around clinical trials research, and I'm very interested in this because I do think if we're more diverse or diversity within the trials, that we can increase our aspect of how trials are better for us. As you can see, I think we talk about biomedical prevention trials, science, treatment, and advocacy. One of the symbols you see up there is the medical apartheid. That was written by a lady named Harriet Washington. She's a medical ethicist, and she really chronicalizes all of the eotropic, of things that we are afraid of in the medical system. She makes sure that she lays it out, including Tuskegee. Tuskegee is just part of it. It's not the entire story. But I just wanted to let you know that that is the shoulders from which I stand on, and that we are promoting getting science in first. Yes, there are a lot of things that are wrong with the system, the healthcare system, and of course the insurance system, and clinical trials, and all the isms that go with it. Racism, feminism, isms. You know, I understand those things, but if you're going to be a righteous contributor, you've got to deal with it and make some solutions to the problem, not just be a problem with no solutions. And so often, many people are problems, but they don't come with solutions. I'm here to come with solutions. So today, I wanted to really talk about not just looking at clinical trials research, but I wanted to talk about an organization called AVAC, the AIDS Vaccine AIDS Vaccine Advocacy Coalition, AVAC. As you can see, AVAC's website is avac.org. The reason that I'm bringing them up is because I really respect this organization, and I really want to make sure that other people know that they exist. They work a lot around global issues that have to do with clinical and as well as vaccine research. It is a very engaging organization in that it is really impacting policies and how things are done through United States as well as other countries throughout the world. If you're interested in more things about AVAC, you can call me in at the AIDS Call-In Live, 312-738-1060. I have my esteemed hostess here, Miss Ajua Pryor, waiting for you to call so she can take your information and relay your call to me. But I wanted to make sure that you knew about AVAC, because I think that some of the concepts they're working with, which are the prevention strategies, as well as the community engagement and research literacy, are two very important concepts that I personally would like to work on in my organization, especially as it relates to, as we would put it, literacy. So literacy is not just being able to read, although, people know literate. I have to be able to know what the word says and what it means, but putting those two concepts together is taking it a little bit further into the science and understanding the processes behind why we do clinical research and how one can get involved. Now, I'll be the first one to tell you that I don't think that anyone should just get involved with any clinical trial and they don't know what it means or why they're doing it. But I also think we should be altruistic. Altruistic means, yes, we should volunteer so we can find out what works for us and, more importantly, what doesn't. That is what trials are all about. But I also encourage, not only should you participate in a trial, you should be the one leading the trial, a part of the trial, being engaged with the trial. And that's what I do as a community representative. We have community advisory boards that work with clinical research, especially in HIV, and the study of it, is the AIDS Clinical Trial Group, the HIV Vaccine Trial Network, the HIV Prevention Trial Network, the Microbicides Network. There are a few networks here in the United States that work specifically on HIV issues. And you can join those trials for free. I mean, they're actually encouraging for community members, especially the AIDS Clinical Trials, which is ACTG, to join as a community advocate. And the reason that I bring that up is because I do know that the AIDS Vaccine Awareness Organization is one of those organizations that makes sure that we are understanding what those trials mean. And because we're understanding what those trials mean, that is what they mean by prevention studies. That is what they mean by making sure that you get the ethical issues behind it. And some of those ethical issues behind it is a trial good if it's race-based? So what do I mean by that? That means, if we had to do a trial for just blacks, is that an ethical trial to have? Well, we've been so disenfranchised, we've been marginalized so long. Some people would say, well, we don't want to be exploited. But at the same time, I'd be one to also offer that if you can do a trial that is not exploitive, but that's exploratory. I've used some different words. Not exploiting, but exploring what some of those differences may be, then that may be a trial that is not unethical, but ethically sound enough to make sure that it's relevant to us. For example, there are some people who didn't know that one of the medications that they use for HIV, I'll just say the brand name is called Sista. That particular drug, if you will, that treatment actually was able to have a trial that was just consistent of blacks, or blacks as a part, we say a cohort, as a part of the trial. The reason that was done so they could be specific about how this treatment medication works in the systems of those people who are considered black or of African descent. That was a very successful trial, and it was able to give better discourse to how that medication works. So as you can see, the science can get very deep very quick, but that's what I want to do for you all, is bring that to you so you are aware that these things are happening. But I also encourage you to be a component of the trial, a player in the trial. I mean, we talk about advisory boards, but I'm encouraging some of you all to become the principal investigator. I hope to do that one day. That is one of my dreams as I pursue my lifelong standings. And I not only want to conduct the trial or be the principal investigator, that's the person that runs the trial, but I want to have it where community advisory boards are actually helping me to design the trial, to make sure that it's ethical, people and to do the collection of the data as well as the interpretation of the findings. And so often we researchers and others in the field think that our interpretation is better than the community's because we think with all our better understanding of research that we can give better information. I know that was a lot of betters, right? But it's not always true. Sometimes the community or people who are not in your field can offer some insight that you may have not understood or you never thought about looking at. Hey, this is the AIDS Call-In Live with Sista Yaa at 312-738-1060. If you have a question about AVAC, like I was telling you, I encourage you to go to their website and look at some of the aspects that they're doing for global advocacy. In fact, one of them is what's happening in Uganda. Uganda is one of 56 countries in the continent of Africa. Uganda has been one of the premier countries, if you will, that has been struggling but striving through the concepts of HIV. It was actually one of the first countries that they know, or the oldest countries that was infected with HIV. Back then we called it AIDS. And they have been doing wonders about grappling and wrapping their mind around what happened in their country using a process of, of course they promoted abstinence, but also using basic understanding and of course using condoms. And so as we use those behavioral changes, they were able to lower the number of new positive cases of HIV. However, as in any country, there's always some issues that have to be dealt with. And one of those issues that they dealt with is their political leadership was not using evidence-based information, that they wanted a society that used evidence-based as well as to address, guess what? Homosexuality as it relates to HIV. And that's a big deal because they make that HIV, they have laws against the transmission of HIV. And sometimes they call it criminalization of HIV transmission. Criminalization of HIV transmission. Let me know if you've ever heard of that before, because that is a true statement that there are people who have been criminalized or who have been put in jail just because they transmitted HIV. Hey, I got a caller. Welcome to AIDS Call-In Live with Sista Yaa. What can I do for you?
One of the problems over there in Africa, the reason why the numbers are still high, because of certain traditions and all that. You got those African chieftains are not doing anything about, where there's still this belief if they have sex with a virgin, in terms like young children are being raped, thinking that's going to cure them in terms of HIV, and that issue has not been dealt with too much at all. There's still that ignorance about that over there.
There is that ignorance, and let's redirect a little bit. That particular incident actually happened mostly in South Africa, specifically in the Zaire area, I believe. Zaire and Zimbabwe. It was Southern Africa where you heard about people who were men, if you will, and thank you, caller, for that insight, men who were having sex with babies. I said it, babies, because they thought somehow that it would cure them from that virus. And the caller is absolutely correct. It's egregious, it's ignorant, and it's unfounded. But hopefully with the right information, the right type of advocates, and that's our word, right? Advocates, that we teach people and we educate people. And you know what? We say that word education, and I'm going to tell you the truth. I don't like the word education because to me it's so misused and misunderstood. But what we're really saying is if we get people thinking about a certain thing with a certain behavior, that's what I want. I don't want you to just know something. I want you to behave it. I want you to implement it. As they would say, Bobby Wright would say, it's consistent application over time that allow us to change our behavior. So we have to apply what we know, not just say it. So what the caller was referring to had and was happening early on in the epidemic around 1990s or so. And we were hearing about these stories. I'm not negating the fact that it probably is still going on, but I am going to say that I think they've made better strides in how to obtain and talk about, and more importantly, people are clear about what this virus is, as well as how not to spread it. And you have to realize, I mean, you know, they go through a lot, and sometimes it's not an excuse for people's fear and what they do out of fear. But we do recognize that when you know better, you should do better. And hopefully that's what's happening in those countries. But let's be clear, that is not the entire continent of Africa. That is one country. So as we speak about countries in Africa, I was referring to Uganda, and the reason being is because they do have the a homosexual law and enforcing of the law for criminalization of HIV. And I brought that up because I wanted to make sure that you know that that's here in the United States, and more specifically here in the city of Chicago. I think that we should talk about criminalization of HIV and how we can make sure that it's not criminalized. This is a public health issue. It is not deemed to be, as you put it, a police issue. Although I would love to work more closely with our police officers in obtaining the right perspective about this particular situation. In fact, I was very encouraged. I went to the International AIDS Conference, and I got to meet 2 police officers, and I've talked about this previous shows, but both of them had taken on the civil disobedience stance, and that they didn't want to lock people up who were HIV positive or who were hepatitis positive or who were injection drug users. They really wanted to refer them to what we would say, you know, a recovery. So I think that we need to change how we interact, obviously, with our police. You know, that's been a very hot topic, and we do need to engage more with them. Hi to AIDS Call-In Live with Sista Yaa.
Yes, and good evening, and happy holiday to everyone.
Happy holidays to you, too.
You know, I love listening to your show. I love the information that you get out. You know, sometimes it's better just to listen than to talk so much. And, you know, just like something was just mentioned, that was 100,000 years ago. If we keep on drilling on the past, and I mean way in the past, how are we going to get anywhere to the future? I heard you in your conversation earlier that you like to speak. You could speak to anyone. It don't have to be anyone that's have a great education of this, but they might have ideals. And sometimes you can listen to other people and say, that might work in this program. I believe in you can listen to a fool and sometimes gather some kind of info out of it.
You at least know what not to do.
Right. Again, the name of this game is you inform us. Let's move on.
Yes.
Let's try to think of some things that maybe one day in our lifetime, this will be something of the past.
Yes.
But
yes.
Again, you know,
I appreciate that.
You always inform us, and here I go again talking. I did not want to talk on this show.
That's okay.
But I do want to just inform you. You're a wonderful person. You have a great day, safe day, and thanks for taking this call.
Oh, well, thank you, caller, and I really do appreciate that more than you know. This is actually our last show for this year, so I appreciate the people who've been following and who have been calling in, but I want to pinpoint what the caller just said. We definitely need to move forward. That's why I'm here. Not to regurgitate what happened in the past, but to plan our future and make our present stand. I want to make sure that we get everybody in. I know it's the last call, or it's the last of our show. We're going to be closing down soon. But I really appreciate all that you all have done and to be listening and calling in. The last things I want to talk about is future topics that I want you all to know that hopefully next year we address. That's comorbidities with hepatitis B and C, HPV, the human papillomavirus virus, STIs, you know, sexual transmitted infections. We haven't talked about that enough. And then microbicides, male involvement with couple counseling, men, okay, youth and condoms, and other topics from the viewers. I just want to make sure that you all know that I am doing what I said I was going to do, and that is having my daughter to be a part of this with me. I wanted to tell her personally, I appreciate you so much. This is who you talk to when you call. She has been doing this for fee, but she has been doing it as a part of supporting our organization, TACS, the Association of Clinical Trial Services. And I just wanted to ask, as a youth, what would you tell other youth about HIV?
I would tell them that they need to stay protected and that they need to be very aware of what else is out there besides HIV. And they also need to be aware of other risks that come with sex besides STDs.
Right. And clearly, I know you all, she's your daughter, so of course she knows. Yes, and she does. I just wanted her to know that I am proud of her. But she can tell you honestly, do we have a real talk about sex and sexuality?
Yes.
As a mother to a daughter, I am very clear that I want her to be successful in life. I want her to get all that she dreams of, but she still is a teenager, and she's 17, and she's doing wonderful in school. And I didn't want her to grow up in such a way that she felt stifled or afraid, but that she was informed. So I just wanted to put her on a shout out because she has been doing so much in helping her mother, help this organization to grow with TACS. And every time you call, this is one of the people that you would talk to, and that's Miss Ajua Pryor. So as I mentioned some of the future topics, one of them was youth and condoms, right? And so the reason I brought that up is because in one of the other countries, they were looking at condoms and calling it condomize, and that's another campaign where they're trying to make sure that condoms are not only used, but that they have an appeal. So if anybody's got any ideas about how to make the condomized program work, let us know. Or do you think that using condoms is just too much of a barrier? The reason I brought that up is because one of the other concepts that we could deal with is microbicides. Microbicides is a substance in which you use to lace your inners to make sure that a virus does not pass through the skin-to-skin barrier. So we haven't really discussed some of those concepts, but I think we should. And more importantly, I really do want to get into partner. I said males, but I am really referring to men to women and men to men. When we're talking about partnerships, we are talking about how this virus is transmitted. And unfortunately, here in the city of Chicago, as we are dealing with more than 25,000 cases of people living with HIV, we've had about 1,000 new cases every year. And unfortunately, we've got an increase of those that have been infected with HIV from the ages of 13 and 24. So as this is my last show, I really want to make sure that I give a shout out to everybody, especially when we had the PrEP rally. Thank you so much to all that participated. The AIDS Foundation of Chicago, Dr. Bell, kudos to Antoine, he threw down. I want to say thanks to the team from Senator Halstead that really stayed with us, and thanks to Michelle from Heartland and so many other people that helped to put this together, my intern who worked with me, and Autumn, and thank you all so much. Continue to look at cantv.org hotline and support our local channel. It is important. It's a great way to get information out, and I want to thank you all for being a part of my life for this past year. Brothers Health Collective, Sista Yaa, I'll see you next year.